All right, buckle up, because today we're diving deep into a system we all rely on, but that can be a real pain to deal with, the American healthcare system. And you and I are going beyond the usual headlines. We're going to really get into what it's actually like being a patient battling insurance companies.
And we're kicking things off with a story that really shook things up, the alleged murder of a UnitedHealthcare CEO, and then the surprising wave of support for the suspect, Luigi Mangione, online.
Yeah, that case definitely got my attention too. But what really fascinates me is not so much the crime itself, but why so many people seem to get where Mangione was coming from, or even sympathize with his alleged actions.
That's exactly what we're going to unpack, this undercurrent of fear and frustration that seems to resonate with so many Americans when it comes to healthcare and insurance. And you dug up some really interesting sources that shed light on this.
I did. I found some pretty disturbing stories from people about their experiences with insurance denials. One that really hit me was a woman who was denied coverage for a biopsy. She ended up paying for it out of pocket, and it turned out to be cancerous. She almost lost half her job because of it.
It's a terrifying example of what can happen when necessary medical care gets delayed or denied. And sadly, her story is anything but unique. A 2023 study by the Kaiser Family Foundation found that 1 in 5 insured adults in the U.S. had a health insurance claim denied in the previous year. That's a huge number of people facing potential financial hardship and health risks because of these denials.
Those numbers are seriously alarming. And there was another story that really got to me. A paraplegic man needed surgery for pressure sores, a common complication for people with limited mobility. But his insurance company classified the surgery as cosmetic and refused to cover it.
That classification is especially problematic because for someone with paraplegia, pressure sores can be way more than a skin issue. They can lead to nasty infections, even bone infections, and require ongoing medical attention. Denying coverage in such cases is essentially putting the patient's health at risk just to save the company money.
It feels like these companies are playing with people's lives. It makes you wonder, how do they even decide what's essential and what's not? Do they even think about the long-term consequences of these denials?
That's a huge question. And it brings us to the core of the issue, the profit-driven model of the health insurance industry. At the end of the day, these companies are businesses, and their primary goal is to maximize profits for shareholders. And one way they do that is by minimizing the amount they pay out in claims.
So it's not just a coincidence that we keep seeing these stories about denied claims. It seems like it's built into the system itself.
It's definitely a systemic issue. And to understand how it works, we need to look at the tactics insurance companies often use to limit their payouts.
Okay, I'm all ears. Let's break down the mechanics of how these denials actually happen.
One common tactic is using very narrow definitions and interpretations of medical necessity, like in the case of the paraplegic man. Classifying a medically necessary surgery as cosmetic allows the insurer to deny coverage.
That feels incredibly manipulative. And I'm guessing this isn't the only tactic they use.
No, definitely not. They also often require pre-authorization for certain treatments. Even when those treatments are clearly needed, according to a doctor, this creates a bureaucratic hurdle for patients and can delay or even prevent them from getting the care they need.
So even if your doctor says you need something, the insurance company can still overrule them.
Exactly. And if the pre-authorization is denied, the patient is often left scrambling to appeal the decision, which can be a long and frustrating process.
That sounds incredibly stressful, especially when you're dealing with a health crisis on top of it all.
Absolutely. And the appeals process itself can be designed to discourage patients from pursuing their claims. It often involves mountains of paperwork, complex medical terminology, and tight deadlines.
So it's not just about denials. It's about creating a system that's so difficult to navigate that they're hoping people will just give up.
You got it. That's a big part of it. And there are other tactics we could get into as well, like using algorithms to identify and target patients who are likely to require expensive care, potentially leading to higher premiums or even policy cancellations.
Hold on, are you saying they're using algorithms to cherry-pick the healthiest patients and leave others behind? That feels incredibly unfair.
It raises some serious ethical concerns about how technology is being used in the insurance industry and whether it's making existing inequities in healthcare access even worse.
Okay, so you mentioned UnitedHealthcare is under fire, but this all makes it sound like a problem that goes way beyond one company, right?
Absolutely. While UnitedHealthcare is in the spotlight because of the recent events, these tactics are unfortunately widespread throughout the entire industry.
So even if someone switches insurance providers, they might still run into the same walls.
It's very likely. The entire system is structured in a way that encourages these cost-cutting measures, no matter which company it is.
That's pretty disheartening. But I am curious, why is UnitedHealthcare getting so much heat specifically? Are they doing something that's especially bad?
Well, the company's response to the CEO's murder, or rather the CEO's response, definitely didn't help their case. You remember that internal meeting video that got leaked?
Oh, yeah. Where the CEO basically said to ignore the criticism and that the company was doing great. It's like he had no idea what was going on. It felt really tone deaf, especially given all the outcry over these denied claims and the real human cost involved.
It definitely didn't show much empathy or understanding of the situation. And if you look at their financial statements, which show billions of dollars in profits, it makes you question their priorities.
It's hard to believe they're actually putting patients first when they're denying essential care while raking in that kind of money.
This goes back to a bigger question about the very purpose of health insurance. Is it just a business focused on making as much money as possible? Or does it have an ethical obligation to make sure people have access to care?
That's a really tough question, but one we absolutely need to be asking, especially with things like that controversy with Anthem Blue Cross, trying to limit anesthesia coverage for surgeries.
That's a perfect example of how these companies are constantly looking for ways to cut costs, even if it puts patient care at risk. But what's interesting is that the public outcry and backlash against that policy actually made them back down.
So it shows that speaking up and taking action can work, that we're not completely powerless in this system.
It definitely shows the potential power of patients and the importance of speaking out against these practices.
That gives me a little bit of hope amidst all this darkness.
It's important to hold on to that hope because the fight for a more just and fair healthcare system is far from over.
Okay, so we've seen how insurance companies are using these tactics to deny claims and protect their profits. But where do we go from here? What can we actually do about it?
That's the million-dollar question. And while there are no easy answers, the sources you provided do offer some potential paths for change.
I'm ready to hear them. I want to move from feeling angry to feeling empowered.
One suggestion is to be more proactive when you're choosing your insurance plans. Really dig into the details of the policy, understand what's actually covered, what's not covered, and pay close attention to those sneaky clauses that might limit your coverage.
Okay, that's a good point. But honestly, even with a magnifying glass, those policies are impossible to decipher. And for a lot of people, they don't even really have a choice. If your work only offers a couple of plans, you're kind of stuck with what they give you, right?
That's true, and it just shows the limits of what you can do on your own in a system that feels rigged against the patient. It's like trying to win a game where the rules keep changing to favor the other side.
Right, exactly. So what about that suggestion to share personal stories, to raise awareness? We've seen how powerful those stories can be in getting people outraged and putting pressure on these companies.
Sharing stories is definitely important. It makes the issue real for people, puts a face to the statistics, and can help create a shared sense of outrage. But we also got to be realistic about what that can achieve. Public attention can be fleeting. And it usually takes more than just personal stories to create real, lasting change in the system.
Okay, so sharing stories is a good start, but we need to go beyond just individual action. What are some other ways we can make a difference?
Well, the sources you found point to the need for bigger systemic solutions. Legislative reform is a key area where real change can happen.
Interesting. What kind of legislative reforms are we talking about here?
There are a bunch of proposals out there aimed at making insurance practices more transparent, strengthening consumer protections, and holding insurance companies accountable for unfair denials.
Okay, that sounds promising. Any specific examples of these kinds of reforms?
One example is legislation that would require insurance companies to explain claim denials clearly and simply, using plain language that patients can understand.
That would be a huge improvement. I've heard too many stories of people getting these confusing, jargon-filled denial letters that just leave them feeling helpless and lost.
Exactly. And another proposal gaining traction is the idea of creating an independent review process for denied claims, where patients could appeal to a neutral third party if they think their denial was unfair.
So it wouldn't be the insurance company making the final call anymore.
Right. Having an independent review process could level the playing field and make sure patients have a fair chance to challenge denials.
These reforms sound like they could really make a difference. But how realistic is it to get these things passed? The insurance industry has a ton of lobbying power, right? They're not going to give up their profits easily.
You're not wrong. It's definitely going to be an uphill battle, but that's where collective action comes in. Patient advocacy groups, nonprofit organizations, even individuals can all play a part in pushing for these reforms.
So it's about joining forces, putting pressure on lawmakers to actually prioritize patients instead of insurance company profits.
Exactly. And that can mean contacting your representatives, supporting organizations fighting for these reforms, and raising awareness in your community.
It sounds like there's a lot we can do, even if it feels overwhelming sometimes.
Don't get discouraged. Change is rarely easy or quick, but it does happen. Remember that Anthem Blue Cross anesthesia thing? Public pressure forced them to reverse their policy. That's proof that collective action works.
That's a good reminder. Okay, we've talked about legislation and advocacy, but what about the doctors? They're kind of caught in the middle, right? Trying to help their patients while dealing with all these insurance restrictions?
Doctors are essential in this fight. They see the effects of these policies firsthand. Their voices carry a lot of weight, both with the insurance companies and with policymakers.
So what can doctors actually do to help their patients deal with this system?
First and foremost, it's about really advocating for their patients, taking the time to explain diagnoses and treatment options clearly, being upfront about potential costs, and helping patients understand their insurance benefits.
So doctors can be like translators, helping patients understand the ins and outs of insurance policies and medical procedures.
Exactly. And they can go a step further by appealing denials for their patients, providing documentation, and fighting for the care their patients need.
That would be huge. Knowing your doctor's on your side, fighting for you, would make such a difference.
It absolutely would. And some doctors are even getting more proactive, joining advocacy groups, speaking out about these issues, and pushing for policy changes that would help their
It
patients.
sounds like there's a growing movement within the medical community to challenge the way things are and demand better for patients.
There definitely is, and that's encouraging. Because ultimately, it's about shifting the power dynamic in healthcare away from the insurance companies and towards the patients and the providers who care for them.
I like the sound of that. It feels like we're moving from a sense of helplessness to a sense of agency.
That's the goal. It's about understanding that we're not just passive recipients of healthcare. We're active participants who have a voice and can make a difference.
This has been a really eye-opening conversation. We've explored the dark side of the insurance industry, talked about potential solutions, and the power of collective action. But I'm curious, are there any other models of healthcare out there that we could learn from?
That's a great question, and one that's definitely worth exploring more. There are a bunch of countries that have taken different approaches to healthcare, with varying levels of success.
I've heard about single-payer systems, like in Canada, where the government provides healthcare for everyone. How does that actually work?
In a single-payer system, the government is the one paying for healthcare services. This means everyone has access to care, whether they have a job or can afford it or not.
That sounds amazing. No more stressing about deductibles, co-pays, or battling insurance companies.
It definitely has its advantages, but it's important to remember that no system is perfect. Single-payer systems often face challenges too, like longer wait times for certain procedures, and maybe limited choices when it comes to providers.
So there are trade-offs, but it's still fascinating to think about different ways to structure healthcare.
Absolutely. It's important to look outside of the US and consider models that might offer solutions to the problems we face here.
Okay, we've discussed a lot of potential solutions: individual action, legislative reform, even exploring different healthcare models.
Yeah.
But I want to go back to something you said earlier about the power of collective action. Are there specific organizations or movements out there that are leading the charge for a more just and fair healthcare system?
Oh, absolutely. There are some amazing organizations doing great work on this. Groups like Patients for Affordable Healthcare are really at the forefront, pushing for more affordable, accessible care. They're working hard to amplify patient voices and hold policymakers accountable.
So they're like giving a platform to patients who are often lost in all the noise surrounding healthcare.
Exactly. They organize rallies, lobby Congress, run public awareness campaigns, putting pressure on the people in power to make real changes.
That's awesome. And you mentioned nonprofits too. What are they doing?
Organizations like the National Patient Advocate Foundation, they provide essential support and guidance to patients who are trying to navigate this confusing healthcare system. They help people understand their rights, file appeals for those denied claims, and find resources in their communities.
That's got to be a lifeline for people who are feeling totally lost and overwhelmed. It's good to know there's help out there.
There are also smaller grassroots organizations working at the local level, addressing specific healthcare needs in their own communities. These groups might focus on things like access to mental health care, or support for people with chronic illnesses, or advocating for communities that are often overlooked.
It's inspiring to see people coming together to make a difference, even on a smaller scale.
And remember, you don't have to be part of an organization to make a difference. Even small things can have a big impact. Sharing your own story, contacting your representatives, or just talking about these issues with your friends and family. That can all help raise awareness and push for change.
So it's about turning that frustration into action, however small it might seem.
Exactly. And recognizing that we all have a role to play in creating a healthcare system that actually prioritizes everyone's well-being.
Well said. We've covered so much in this deep dive, from those unsettling insurance denial stories to the complexities of policy reform and the power of collective action. But before we go, I want to leave you with something to think about. If you could start over and design a brand new healthcare system, what would it look like? How would you balance making a profit with the moral duty to provide care?
That's a huge question, and one that deserves real careful thought. There are so many different approaches out there, and no one solution is going to magically fix every problem. But it's these kinds of conversations, these explorations of what's possible, that allow us to start imagining a better future for healthcare in America.
That's a great point to end on. Thanks to everyone for joining us on this deep dive. We hope it gave you some new perspectives and inspired you to really think about these important issues. Remember, your voice matters. Don't underestimate the power of asking tough questions, speaking up for yourself and others, and demanding a healthcare system that works for everyone.
And don't forget, there are resources out there if you're struggling with the system. Reach out to patient advocacy groups, connect with local organizations, and keep the conversation going. Change starts with each of us.
Thanks for listening. Until next time, stay curious and keep learning.